Hello, how are you? Welcome back to my series of enlightenment regarding healthcare issues. Today, I'm going to discuss about the need for hospitals. When I say hospital, I'm referring to healthcare delivery system, which consists of the primary healthcare, the secondary healthcare, and the tertiary healthcare. Primary healthcare, which has to do with clinics, primary healthcare centers, and comprehensive healthcare centers, and secondary healthcare, which consists of general hospitals in the states and other general hospitals that are not of level of the tertiary healthcare, because tertiary healthcare consists of teaching hospitals, specialized hospitals, and other sophisticated hospitals that have higher standards in terms of personal equipment, etc., and expertise. So we need to be proactive. Yes. How do we intend to be proactive in terms of quality healthcare service delivery? Yes, we need to really set up a strong quality assurance machinery or units in our hospital to ensure proper monitoring, proper evaluation, ensure attendances of staff, and to avoid absenteeism, to ensure all the necessary equipments that are required for a standard of care, as well as reagents and machines to do some certain investigation are really available. We should know that patient care is but a very important phenomenon, because when we lose a human being, we've lost him forever, and life is very sacred. So, because if we become proactive in terms of quality service, and which goes with quality assurance, we are going to reduce a lot of cases that may lead to litigation and medical legal issues that may affect the hospital or professional, be it doctor or any other healthcare professional. Ideally and traditionally, we do have one of these quality assurance program, a kind of medical audit committees which exist in the hospital. Medical audits is a systematic analysis of the quality of patient care, which consists of the process of diagnosis, the treatment, the resultant outcome of the treatment and care, and also the satisfaction of the patient based on the care rendered, and to ensure that everything has been done as expected. So this medical audit is usually being done periodically by a committee established by various hospitals to ensure quality assurance. Even though in healthcare, the principle of medical audit was based on corrective rather than punitive, it's a peer review which has a committee from various departments, clinical, and even the health information medical records department, because the audit could be either retrospective based on discharge of the patients, and the medical records department has to bring the discharged patient records for consideration, and also to locate them whenever the committee is needing them. And the other to also provide their own input and assessment and make comparison with the established standard of care or standard operating procedure departments, because the audit has to be done based on a selection of a case that relates to a clinical department. So it depends on the topic selected by the audit committee for that assessment. Even though it's punitive, as I mentioned, and corrective, I mean not punitive, but this is internal matter. It's an internal auditing. At times, patient relations may complain about some kind of ill treatment or maltreatment or bad practice or shortcomings as regards to the patient care which they received for their relations, and they may take it a legal matter. So when legal issues comes, the committee's findings might be subjected to judicial proceedings. It's like opening a can of worms. So that's the reason why we need to be very careful in ensuring standard complied with, to make sure that we restock our drugs, we provide the needed equipment, we become very good in monitoring attendances and of course monitor absenteeism, and to retrain and retrain and to improve on patient care relations, and also to provide a feedback mechanism from the patient so that it can quickly be responded to if there is any negative performance. And that's the reason why the audit can be retrospective. Medical audit could be retrospective after the discharge of the patient. It could be concurrent. You know, get information from the patient why he's still on admission before discharge. And it can be prospective. Yes, prospective means how to arrange for a good audit and to ensure that standard of care is being met. Because when petition comes, actually, it can escalate not just to the hospital administration, it can go to a regulatory body, it can go to the institutional authority, like the government, and it can also go to the courts. And you can never know what will be the outcome of that findings. No, that's the reason why we should always be compliance in standards, because in court, the judge may ask a very experienced person to come and explain whether standard of care has been made or not, based on his experience and expertise. So if it is found that the standard of care is not attained, then that means someone can be found to have committed a malpractice or negligence. Thank you very much.